Hello, my name is Evan Keller, and I will be doing a heparin injection demonstration on my patient Skip Rocker. Prior to getting the medication, I will adhere to the 6 rights of medication administration, namely right patient, right medication, right dose, right route, right time, and right documentation. I will wash my hands and I will acquire the ampule, making sure that there's no cracks in the ampule or there's no disrupted integrity. I will flick the top of the ampule to displace any of the fluid stuck at the top. In this case, it was already all on the bottom. I will check the expiration date, and then I will open up my gauze pad. And I will wrap it around the top of the ampule, being sure to break towards me so that if any glass shards do fly out away from me. Then I will take the syringe and remove the needle that comes standard with it, if I can. And I will open up the filter straw. This is used so that potential glass shards that have gotten the ampule do not get inside of the syringe. I will insert the filter straw, being sure not to touch the edge of the ampule. And I will withdraw the medication. Then I will further take in 0.2 milliliters of air. Then I will remove the filter straw and dispose of it. I will reattach the needle and then I will place the needle down. I will enter the patient's room and ask for 2 verifications of identity, namely the patient's name and date of birth. I will tell the patient that they're to receive a heparin injection, and in this case I will be administering it to their abdomen, making sure to administer it at least 2 inches laterally of the umbilicus. I will don my gloves. And then I will clean the site where the injection will take place, namely the lateral of the umbilicus. I'll clean from the center of where I will inject outward, being sure to let the area dry before I inject. Take the needle, remove the cap, and if this person had a fair amount of adipose tissue, I would inject at a 90-degree angle. In this case, this person does not, so I would inject at a 45-degree angle. To do this procedure, I will pinch up some of the adipose tissue and inject 45-degree angle, and then stabilize the needle and inject the medication as well as the air, being sure not to go too fast. I'll remove the syringe, dispose it in a sharps container if there was one nearby, but there is not one nearby, so I'll use the one-handed technique to put the cap back on the needle. I would ask the patient how they tolerated the procedure, and I had forgot to state this earlier, but they would be laying in a supine position with their head forward in a comfortable position, semi-Fowler's position, if you will. And then I will take my gloves off, wash my hands, and leave the room and put in documentation in the MAR that I had done the procedure, stating the time, the medication, the route, time, medication, route, patient, dosage, and of course I'm documenting, and then I will be done.